Konnichiwa minasan. I'm here today to make a video to address the topic of detransitioning and also what does transition mean to you? The topic of detransition came about from me looking up on videos and being very interested in finding out what other people have done and why they stopped transitioning and what their whole thing was on detransitioning. You know, sometimes people have a reason, this might be their health, or maybe they might find this more of a social reason or something at heart that probably affects them. They say, you know what, this sounded good, but I don't want to do this anymore, or this is not the path, or something that's right for me here at this point in time. Some people detransition or decide to come away from that for financial reasons. Maybe they're not ready to pay for the extra surgeries or things that might help them be more passable. Maybe they decide, well, there's a little bit of something going on here that I'm not crazy about. I kind of knew about it. Maybe I didn't kind of know about it, but there's something going on here that I see I really don't like, and it's not right for me to do that. You have to understand, folks, transition is not a small thing. It's a very big thing. I'm not the master, the expert of it. I'm merely speaking from my experience of what I see out there and what I've known from other people, and also see it from my perspective to some degree. I'm part of the male to female community. I have not femaled yet, but I am what I am from the inside out, and I don't have to be anywhere ashamed of that. I think that that's a wonderful thing. Um, but I do get curious as to what happens. When people take hormones, it does come at a certain price. I mean, there's a lot of wonderful changes that happen, both male to female and female to male, that help people pass. On the female to male side, I've seen some things happen where people might develop yeast infections, urinary tract infections, things of that sort. Sometimes, and I have heard there are heart related issues that come about with that, certain level of risk with that. You have to understand the female body is not designed to have testosterone as a prevalent thing in that type of person. So the body does react to that. And I've heard that yeast infections do develop on the count of having very low estrogen levels, which is something that usually older women, I think postmenopausal, will come across that type of thing. But that's when people get older much later on. You might have female and male people that exhibit those types of symptoms that come out from an early age when they transition. So that's something to think about. It's something that can be painful. It's something that can be something to deal with. Some female and male people might be fine and they might be okay without these symptoms. Some people develop it. So that's something to think about. Along with an increased libido, I think that's probably fine and dandy. Some people are taken by that. They're kind of surprised by it. On the male to female side of things, I don't have all the information, but there is a certain level, a certain chance of developing cancer that's increased. So there is a higher level of developing cancer. It's that can be quite serious. I mean, people are looked at. I think it's like every 3 to 4 months, that type of deal. So doctors and medical people do monitor you and do keep an eye on things. That's very, very important. All the feminine qualities that come about from that are very desirable, and I believe that's something that does help people pass on the male to female side very much, and even on the female to male side. Um, some people have a hard time dealing with the increased level of emotions that they feel, that type of stuff that they process. If something made them sad before they're watching a movie, they may be developing a more stronger emotional response to that very same thing later on if they do take the hormones to transition to live life as a woman. So some people have a hard time dealing with that. It's not always the most desirable thing. And also, people on the male to female side develop a lower libido. So there's that type of thing going on. It's it's stuff to think about. I mean, does it affect people now? Does it affect people later? you kind of have to think maybe 10, 20 years down the road or 30 years down the road. And if you're lucky you live a long life, do you like, 80, maybe 90 years old? So great, that's fine. But the body's not meant to have this artificial thing in your body. It's something where research hasn't necessarily been done to find out the long-term effects of hormone therapy, onto people. So that's something that I think people should probably be a little more concerned before considering a transition by way of hormone replacement. Um, I think it's a good thing on one hand, but there are those risks involved. Now, to people who detransition, whatever reason it may be, there's nothing wrong with that. I mean, hormones are not the right thing for everybody. If you do it by way of hormones. If you decide to detransition, okay, fine. You got some of this going on, it's hard to deal with, blah, blah, blah. Okay, by all means. But I don't think that it's right for anybody of the community to go and beat up on somebody else who has decided to detransition, and not only decided to detransition but put this out here on YouTube and on video and some kind of media. Doesn't make them any less of a trans person, not at all, not in any way, shape, or form. And how they decide to live their life detransitioned is up to them. I think that that's a wonderful thing. And I think for trans people on a whole, it's already tough enough as it is. I mean, you got to have a positive perspective on things. Depends how you deal with things. When you talk to that therapist, you got to get at the root heart of what do you think is important to you? What do you really see? Do you value your health? When you get sick, how do you feel when you get sick? Let's say you have the flu. The flu's a pretty bad one. Every time I have the flu and I come away from the flu, I come away from it saying, oh my God, I'm so glad to be well now, because those 2, 3 days were pretty tough. And if I had to lie in bed and be sick like that all the time, boy, it's something I wouldn't want to deal with. So thinking of health, that's something that I value very much. I don't like to be taken away from my normal activities. Um, it's something that you gotta weigh out. I think those people who detransition are very brave. I think they were very brave to start the transition. Um, some of those people end up and they go on and continues the transition. So they see something there and they weigh the pros and cons of it at that point and decide they want to go further with that. But I don't think anybody should be beat up with anything. I'm the type of person, I'm trans, I'm male to female type of person. I haven't femaled yet, but I am what I am from the inside out. And there's nothing that's going to change. If I want to present, great, I want to present. But I'm not going to sit here and, have to listen to somebody say, well, there's the girls and there's the real girls, and have to tell me who's a real trans person and who's not a real trans person. I don't think that that really matters. And some of those people, they just dress up and they present behind closed doors. You know, you have to think about that kind of stuff. I respect that, yes I do. But I don't think that anybody is any less than anybody else, no matter what kind of transition they take. Okay? Now, maybe a transition is going to be different for everybody. What do you choose to transition as? Do you want to take the hormones? Maybe you don't want to take the hormones. Some female and male people, they go and they have top surgery, and maybe they might have a little bit of something extra done, I don't know. But there's nothing wrong with that without taking the hormones. Nothing wrong with that at all. If they want to have their breast removed, great. Some male to female people might have FFS and, permanent hair removal. And I don't know, maybe they might go as far as like breast implants. I think that that's a wonderful thing too. That choice is entirely up to them. You have this one life to live. You make your choices. You gotta weigh things out. When you talk to a therapist, don't let anybody kind of push you in one direction or the other. Try to talk to them probably as much as you need to try to figure things out. And even more so, even if you have that letter, even if you have that letter to go and get hormones, even if you have that letter to go and get surgery, try to get to the root problem of what kind of issues might be further down into you. Find out about it. It's a little bit extra work, and maybe people don't like that, but maybe you come away from it. If you do transition, then you decide to transition and say, I looked at everything and kind of weighed it out. Okay, you got to come out to make the best decision for you, no matter what anybody says. Okay, even if, let's say, for example, if I went to the therapist, which I've been in, and they talk to you and encourage you to do this type of thing. Great, okay, it's fine. But do you take that and say, well, because somebody gave you a stamp and a seal of approval, that you go ahead and do that? It's still up to you. You make that choice. I'm not saying that it's something that saves your life. Some people, it may seem that way. Maybe it will, maybe it doesn't. We don't want to lose any people. I think if anybody needs to make a transition, they find out a life or death thing, okay, maybe by all means, maybe that's something that they have to do. But I think for a whole, maybe everybody, it's not necessarily a life or death kind of thing. It's a matter of finding your way in the world. If I were to offer any advice with regards to transition, I think that people need to go and empower themselves. Now, when you're young, you kind of look at it and say, well, if I start on the hormones earlier, maybe I'll get better results. And I think to some degree that's true. But when you're young, you're not very well established. Maybe you have a degree. Maybe if you've been through university or a college and you've earned that, maybe you have a very good paying job, maybe. But most people, when they're very young, they don't have money. They're not out of their parents' house. They're not independent. They're not paying their own bills. They're not well established. And even if they have a degree, do they have a job? Do they have experience of that job? Have they become well versed in what it is they do to make themselves more marketable? You kind of look at it and say, well, if I lost my job tomorrow, would I be able to find another job? It's that sort of thing. From my experience, that's always kind of held me back a little bit. I've never felt very comfortable with it. But these days, for over a year now, I've been well established at my company, and I'm still establishing myself more to get to the place where I need to go before I do anything. The consequence of that is that you're older. But if you're older and you're more secure with things, isn't it very good to have that versus being young and poor and not having any money, and then you're caught up in a situation where maybe you need certain things that your finances could help you, and you don't have those finances there. It's all stuff to think about. The world's not necessarily a fair place. Don't expect the world to hand everything to you, but sometimes you have the tools in front of you to make life better too. So use those tools. Get that degree, get your credentials, get your job experience, establish yourself well, give yourself a good place to live, buy yourself a nice car, pay your bills on time, be financially empowered, and show the world that you can be the best of what you can be, and even better. So that when somebody looks at you and you're going for a job interview, regardless of the fact that you're trans, they will give you that job. Why? Because you're good at what you do, and you have credentials, and you're the best of the best, and there's no reason why they can't give you that job. That's my 2 cents as to transition, detransition. I hope that somebody got something out of this video, and if you do see somebody out there who's detransitioning and choosing to live their life the way it was before, be good to them. They're also one of you, just like the community. Everybody else is pretty much the same, no matter where you come from, on female to male or male to female. We're all one big family. We got to be good to each other. Alright? I hope you guys got something out of this, and I hope you enjoyed this video. Bye for now.